Phil?
Hello, Governor. You say you are following the CDC guidelines, but the CDC guidelines say if someone in a classroom tests positive, then everyone in that classroom should be tested and quarantined. Your plan does not follow the CDC guidelines. You said last week it was because of a lack of testing capacity. If we do not have the capacity to follow CDC guidelines, how can we safely reopen schools?
Well, we follow the guidelines to the extent that we think that's possible. The turnaround time in testing obviously creates a real challenge for congregate settings like schools. So we're developing with the resources and the limitations that we have. We're developing the best strategy to go forward, accepting and following the CDC guidelines to the degree that we can to make sure that we provide as much safety as possible when we provide in-person schooling.
And I guess I'll return to my question. If you do not have the ability to follow CDC guidelines, how can you say you are safely reopening schools?
The CDC also says that the best way for kids to learn is that we should have in-person learning. That's their guidance as well.
I'm talking about testing capacity.
I'm sorry?
I'm talking about testing everyone who is in the classroom.
So they give a number of guidelines, and as I said, we follow to the degree that it's at all possible, we follow guidelines to move forward with what we think is best for our state.